Okay, she said she'd be out about 2 o'clock. So I will have Lanny introduce his program today.
All right, very good. I'd like to welcome these ladies here. Now, they told me they would do their own introductions. I think that had something to do with Pete being all the antics that he pulls. They may have thought that all Rotarians were comics and were scared for me to introduce them. So without further ado, I have Miss Stacy Richards and Tricia Thompson.
Thank you guys for inviting us and so that we can come and share with you some information that is dear and near to our hearts. My name is Stacy Richards. I am the program manager for Community Heathcore. We offer substance abuse services. We are licensed chemical dependency counselors for the state of Texas, and I'm nationally certified as a master addiction counselor. And we're going to talk to you guys about opiate use disorders. We know that that is a national epidemic right now, and so we're getting out in the community more and more, educating people about opiates. I never would have thought in my 23 years of working with substance abuse that we would have this epidemic, right? So it's something that is very common in our area in East Texas, and I'm going to talk to you about some of the stats that is taking place right here in our area. So, without further ado, Trisha's going to be my clicker. Will it work from back there? Okay, great. So let's look at the scope of the problem. Opiate overdose, it is a major public health problem in the United States. Overdose deaths involving prescriptions increased to about 17,000 deaths a year in 2010, and that almost doubled since the year 2001. So since 1999, opiate overdose deaths have increased to 265% among men and 400% among women. So that's pretty staggering to see those numbers. It nearly fourfold increase in the use of prescribed opiates for the treatment of pain. In 2014, an estimated 1.9 million people had an opiate use disorder related to prescription pain pills, and an estimated 586,000 had an opiate use disorder related to heroin use. So, what it looks like here in East Texas, the numbers are staggering. In Longview ranked number 17 in the top 25 cities in the United States.
Wow.
Not just in East Texas, but in the United States. We ranked number 17. But look at Texarkana. They ranked number 10 of this crisis. 10 in the top 25 cities in the United States. Not just in Texas, but in the United States. Top 10. So there is a crisis here in East Texas with opiates.
Is that number in the people that are addicted to opioids, or is it the deaths, or what does that number?
The number is the people that are abusing opioids and not taking it as prescribed. So, yes, great question. So let's look at what are opiates. Opioids can be considered or is considered illegal drugs such as heroin, but they're also prescribed medications to treat pain. And we're seeing a lot of people that are abusing these medications like morphine, codeine, methadone, oxycodone, hydrocodone. So we're seeing a lot of people that are getting these medications from the cabinets of their grandparents, people that may be taking prescribed medication for pain. So it's important that we keep those medications locked and secure. They are highly addictive and people abuse those medications. Opiates work by binding specific receptors in the brain and the spinal cord and the gastrointestinal tract, which minimize the perception of pain. But also, opiates can cause drowsiness, mental confusion, euphoria, nausea, constipation, depending on the amount that you use, and it can depress your respiration. Trisha is, she used to work at Oakhaven Recovery Center. We both did. And we worked at a detox facility. And Trisha was one of my detox counselors. And she can tell you firsthand of the symptoms of people withdrawing from opiates. It doesn't look good at all. And she's going to talk in a little bit about this new drug that's out that the FDA just approved, a new opiate. Even though we're in the midst of this crisis, the FDA just approved a new opiate. Can you believe that? So anyway, stimulating these receptors, which is your reward center in the brain, can trigger other symptoms in the body, such as your mood, your breathing, and your blood pressure. So mainly what we see for someone who's addicted to opiates, it stimulates the mood. They want to change the way they feel. It's unfortunate that some of the people that we see that come into our clinic had some type of injury, right? And so they got prescribed a pain medicine. However, the cycle continues with that reward system. The pain medicine is actually depleting the reward system that's already in your brain to give you that pleasure. So now your body is becoming dependent on the medication. But there's a thing called tolerance, where you have to have more and more to get the same effect. And so that's where dependence comes in. When your body is building up tolerance for the drug. So addiction happens, and I've told you guys how that works and how it regulates your mood, perception, and your organ function. So how do we diagnose? Well, you have to have a strong desire for it. We look at, can you control or reduce your use? And most of the time, people cannot control or reduce their use because their body is now depending on that substance to make them function or just to feel better. So we also look at, do you continue to use despite negative consequences, or are you able to fulfill your major obligations and social functioning? If you're starting to miss work, or if you're starting to not want to be around people, those are things we look at. You use the large amounts over a period of time. That's what tolerance is. You build up tolerance, so it takes more to get the desired effect that you're looking for. And we just talked about tolerance. Spending a great time obtaining and using the opiates. That is one that we break down. Do you get up in the morning thinking about it? Do you miss paying a bill because you want to make sure you have money for your pills? You know, those are the things that we look at in order to diagnose this as you have a problem with opiates. And then, of course, the withdrawal symptoms. Withdrawal symptoms from opiates look very much like the flu. We see people that come in and they are nodding. They can't stay awake. They're in pain, of course. They have runny noses. They're just so irritable and discontent. And sometimes we have to send them to a medical detox facility so that they can get medically detoxed, because withdrawing from opiates on your own can be deadly, okay? Because your body is now susceptible to that opiate for relief. So we do assess. Okay, so who's at risk? Anyone is at risk to be an addict, okay? It's not what we think, somebody living under the bridge, homeless. Anyone, especially with opiates, is at risk. We all probably have dealt with some type of injury or some type of pain if you keep living long enough. The main thing is to make sure that we take it as prescribed, and I always encourage people to try over the counter first instead of just going straight to an opiate. Heroin users, of course, these are at-risk people receiving rotating opiate medication regimens, which was what we call cross-tolerance. So you may take an ibuprofen and then a hydrocodone, but you may get addicted to the hydrocodone, but not the ibuprofen. Now the ibuprofen is not working, so I need something stronger. So those are some things you need to take a look at. Also, who's at risk? If you have a medical need and you have a history of substance use, whether it's alcohol is a substance as well. We see a lot of people come in that have alcoholism and in their families, and that makes you high risk for having a substance use, coupled with medical issues that you may have been prescribed an opiate. And of course, if you've been recently released from incarceration or you're a past user of opiates. MAT is medication-assisted treatment. With MAT, I'm sure most of us have heard of methadone clinics. Methadone clinic or MAT services is a program that is FDA approved to provide medications to help with the pain when someone is withdrawing. Okay? So opiate treatment programs also combine behavioral therapy, so we do group therapy, and medications to help alleviate some of the pain while you're withdrawing from the opiate. So these medications commonly used to treat the opiate addiction is methadone, which you take a daily liquid dispense at a regulated clinic. So you'll see people probably getting up at 5 o'clock in the morning, going to the methadone clinic to get their daily dose, and then they can go to work for the day. But the goal is to taper, right? The goal is not to replace methadone for your opiate. And I think sometimes people get confused with that. But they do see a counselor. There is a doctor that's regulating how much of the methadone. The methadone is a synthetic opiate that does not give them the same effect as an opiate like hydrocodone. So it's not one and the same. There's a daily pill or a monthly injection called naltrexone. And so this is office-based. You see the doctor, and the doctor can give you this injection or daily pill. And again, the object of the goal is to get tapered off all opiates. And then buprenorphine, which is an office-based daily dissolving tablet or a 6-month implant that they can put under your arm. Now, how effective is medication-assisted treatment? It's very effective. It's proven to be clinically effective and significantly reduce the need for detox. So the ultimate goal is for full recovery and a self-directed lifestyle. MAT services have proven to improve patient survival. It increases retention and treatment. It decreases illicit opiate use and criminal activity. It increases the patient's ability to gain and maintain employment, and it improves birth outcomes to mothers. Did you know that if a mother who's pregnant and taking an opiate, that doctor will not get her off those opiates because it will affect the fetus? So what they would do is monitor the pregnant mother and keep her taking that opiate. I know that sounds cruel, but that would actually hurt the fetus to take her all the way off that opiate. Okay, so strategies to prevent overdose. Knowledge is key. I'm so happy I was called to share some of this knowledge with you guys because it is an epidemic in the United States, and most people don't realize that, hey, why don't you just stop? It is not that simple. If you've never had an addiction, you don't know. You can't just stop. So knowledge is key. Ensure access to treatment. Know your resources. We do have brochures that we passed out. We are an outpatient facility, and we can treat those that are actually trying to taper off the opiate. Now, if you're taking your opiates and you're not about trying to taper off or do something else to self-manage your pain, then you probably won't be a good candidate for treatment, okay? So you have to want to have recovery. We can't want it more than you want it, and we tell our clients that all the time. Ensure ready access to naloxone. Now, let's talk about naloxone. This drug is administered to anyone that may be in current overdose. This drug can be bought at any pharmacist without a prescription. So if you live with someone that is taking an opiate and you know they're abusing it and they may have taken too many, because sometimes you just don't know, and someone is falling out or they're not looking like themselves, they may have taken more than what they're supposed to, this drug will help save a person's life, naloxone. Is it a pill or injection?
It's an injection, and then you can also get it in a form where you can put it up their nose and they can breathe it. It's like a kind of a spray that you can put up their nose, but most of the time the injection is what people will use because it has a little bit more potency to it.
Right. So a lot of times when people overdose, and we've seen some overdoses this year, and we've seen more deaths than we wanted to. One is too many. But if people realize that they have this, and you can just go to any pharmacy, you could save someone's life. Call 911 immediately. And encourage your prescriber or your doctor to use the prescription drug monitoring program. These doctors are supposed to be looking to see for those that continuously have or want a script for an opiate. They're supposed to look at this monitoring program to make sure that the patient is not going from this doctor to this doctor to this doctor to get an opiate. So encourage your doctors to look at that. If you have a loved one that may be struggling, that's an accountability piece, which is a great piece. All right, and that's all I have. And before we get to question and answers, I'm going to turn the mic over to Tricia, and she's going to talk about this new drug that the FDA just recently approved, another opiate.
Hello. Just a little bit about me. I am a LCDC at Community Heathcore, and my main purpose right now with the contract that I'm under is I treat women and children. So I have all women on my caseload. I have just about 95% CPS cases, and it is a lot. It is a whole lot. Before I started doing this, I really didn't realize you don't even know who you're standing next to in Walmart. You don't know what they're going through. You don't know what's happening to them. And it opened my eyes to understand. I've treated everything from RNs to pilots to train conductors to doctors to lawyers. And it's really, really serious. It's really serious. Anyway, so I can answer more questions if you have them. This is a drug called Dusuvia. It's DSUVIA. And of course, we all know about hydrocodone and that was basically the drug that everyone used as far as pain management. Now they've moved on to OxyContins, which is a little bit stronger. And now we've got a rash of fentanyl. Fentanyl is what has killed a lot of different people as far as public people. I believe Prince died from fentanyl. And it takes about the end of a pen, like a pen that you would write with, the ball. That's about how much it takes to kill someone. There was a police officer not too long ago who stopped a car, and the guy dumped the bag on the floorboard, whatever he had in the bag. Anyway, fentanyl was mixed in with it, and the officer just dropped it because it got into the system. So it's really, really dangerous. This drug I'm going to talk to you about is 5 to 10 times stronger than fentanyl. It passed with a vote of 10-3. So they believe that it is for acute pain management. And those were the words that they used. Rayford Brown, an anesthesiologist, is one of the people who really has gone up to bat for this drug and asked that it not be put on the market. Their arguments were more or less that they were going to use it in a hospital type setting. We all know that that's where it starts. All the drugs start pretty much in a hospital setting, and then someone gets paid to take them out of the hospital, and then we've got them on the streets. Sufentanil is what this drug is called. Sufentanil. It's a synthetic opiate. It's used for it's used in IVs. They also have developed a pill, and the pill is really, really small. When I looked it up on the internet, it looked like about the size of the Tylenols, the 81 milligram Tylenols, of little bitty ones. It's about that size. It dissolves under the tongue. It can last, the relief starts from 15 minutes to 3 hours after you've taken the medication. The adverse effects are, of course, the misplaced pills, the accidental exposure to it, and the overdose. The company lowered the dose from 24 to 12 tablets. So, more or less, if this drug is prescribed, they were going to prescribe 24 of them. Now they're talking about prescribing 12 of them at a time. And again, this is passed not over the counter. This is not going to be sold over the counter at this point. But who's to say that it won't be at some point? Brown's thought was it has substantial risks for respiratory failure, abuse, and death. Right now, the drug is restricted to a level 5, which there's certain levels of narcotics that they have as far as at Walgreens, CVS. So this is going to be one of the highest level, of course, of drugs that is prescribed. They are wanting right now to just basically limit it in, like I say, hospitals, but that's probably not where it's going to end.
What is that scale?
Sir?
Level 5 out of what?
They have basically 5 to 1. There's 5 levels of narcotics that you can get.
Well, this is worse.
Yes. Anything that if you ever go to Walgreens and you have to show your driver's license for anything, including Sudafed, they consider that a narcotic through the FDA. Dr. Brown said that we've learned some hard lessons in the United States about some of the drugs that they've put on the market, and he says, quote unquote, people will die if we put this drug out there. So it's just important to know a little bit about it. It's important to know what we may be facing. Our main concern, like I say, are children that are growing up in this, because they're born addicted. They're born addicted. And so we look at that and it's really scary. So, but that's what all I've got on that. Any questions?
Didn't I read somewhere that that new drug is 1,000 times more powerful than morphine?
Yes.
1,000 times.
Yeah, because fentanyl is about, it's about 500 times more potent than morphine. So this drug is going to be 5 to 10 times more potent than that. Yes. Yes, sir.
So if you have a family member that is going through chemo or prescribed morphine, and you have teenagers, be careful with those medications, making sure that they're lock and key, because some people have to have those pain pills. Morphine, they're in pain. But we just don't want anybody to get to those medications and abuse them. And then we got a big problem. And that's how most of the medications get abused.
I had a question. How did the policeman who came in contact with the fentanyl when it was dumped on the floor, well, how did he get that into his system?
He was searching the car, and as he bent over and kind of lifted the floor mat because it was on the floor of the front of the car. So as he lifted the floor mat, it's a powder form. So it kind of just went up into the air, got into his nasal cavities, got on his skin. And that was the other thing, nobody could really help him because if they touched him, it was on him. So it transfers that way, and people don't know that. You know, methamphetamine, marijuana, cocaine, it transfers skin to skin contact.
And we see a lot of, she works with a lot of women and children, and we see a lot of children that test positive for methamphetamines. Well, of course, we know they didn't smoke methamphetamines, but because of their parents using it in the household, it's in the couches, it's in the curtains, it's in the carpets, and babies are crawling everywhere. So it's pretty, even in your skin and your pores, it can get into your system.
Yes, sir.
You mentioned earlier the part of the addiction comes about when there's elimination of the brain receptors. And so they have to have that. Do those ever regenerate? No.
Yes, yes. As long as you stay clean and sober, and you're not adding that substance, that's the wonderful part about the brain. The brain can heal itself, and the brain can get those cells back. But you gotta stay clean and sober and not include that substance in your body. I mean, the longer you use the substance, the more damage you do to the brain, of course. Good question. Yes, sir.
Well, you said earlier in the program that if you experience a situation or whatever, to call 911. What do you tell the person that answers, I mean, the policeman or the deputy that answers the phone? What do you tell them? I mean, you expect them in a car wreck or a fire or?
You can potentially tell them that you suspect that someone may have overdosed. And they will generally ask you, usually you're gonna get a hold of dispatch, so they'll generally ask you, do you have Narcan available? Or naloxone, which is the same thing. And if you do, then they will let you know how to administer it, or if you don't, then they can help you through that. But it's really important when you call 911 to let them know if you suspect someone's having an overdose, because they can potentially send a note to have naloxone or Narcan with them so that you can get those people up and going better. You can give CPR, but it shuts and it's good too, always give CPR, but it's good to get that going because it shuts everything down. But even after the naloxone or the Narcan, they still have to go to the hospital because it's only going to break that receptor for so long. It's about a 30-minute period. And then, the opiate is still in the system. So.
Right, just be honest with everything that you know about the person, what kind of medication they're taking that you know of, how much you think they've taken, because those are questions they're going to ask when you call 911. Yes, sir.
So what does it cost one of your patients to go through your treatment and to take these drugs and to mediate the situation? And then my other question is, what is the legal or law enforcement or the penalties or misdemeanor or felony, whatever, if somebody's taking it and they run across a law enforcement situation?
The costs for our program, 99% of our clients are indigent and operate under the state funds. We have state funding, we have private pay, we have self-pay. But if someone comes in, we take a look at the financials to see if you meet that state funded level. And some may have to do a copay. But we work with you as far as if you have to pay, and we'll work out a payment plan. So we just want to help people. We are not a methadone clinic. We don't provide MAT services. We don't have a doctor that prescribes. But if someone comes into our clinic and has an opiate use disorder, we encourage them to go get detox first or methadone while coming to our program for the behavioral therapy and the counseling. We provide mostly the group counseling and the individual counseling while they're in MAT services, medication and treatment. The other question, the law enforcement, if they're caught with an opiate, the first thing they're probably going to ask is, do you have a prescription? Is that correct?
Mm-hmm.
And
And
what
then
else?
after that, it's going to be, they're gonna test it and see what it is. And most, in the state of Texas, it's a felony. So then you're looking at, depending on how many you have, you're looking at potential jail time, or you're looking at probation. Now, we work really close with the law enforcement side of it. We actually have a TDCJ program that we have at our facility, and then we do probation as well. So, I mean, the truth of it is that the law enforcement end, the judges, everyone's seeing this epidemic. Everybody is understanding it. So they would much rather send them to us than send them to the jail where they're not going to get any help. So we're having really good feedback with that. We're working really well together. All of that's coming together really well. But usually if they get the treatment, sometimes it's a reduce in their sentence. Just depending on how much they have, what they have, depending on if it's just a possession charge or a manufacturing distributing charge. It just kind of depends on what they have and how much they have of it.
Is there any kind of program that these doctors are doing to cut back on the prescription for prescribing these drugs? Or are the doctors getting on board saying, hey, we made a big mistake?
Some of them.
Some of them.
Some of them. I would be standing up here lying to you if I told you that some of these doctors are not getting paid under the table, and that's just the truth.
Yeah, well, there was a clinic up in New York a couple of weeks ago that was busted by
Yeah.
the FBI.
But generally
Millions
speaking,
of dollars of illegal prescriptions being
Right.
prescribed.
generally speaking, most of the doctors that I've had any contact with or that we deal with on a daily basis, they're totally on board. They're willing to work with us. They don't want people, to have this. They don't want this epidemic to happen. But it's just it really is the lack of education, because most doctors are not trained in substance abuse. So when the doctors call, we actually talk to the doctors, and we work real close with the doctors and have really good communication with them, and are able to help them get what they need and work simultaneously together with them.
That's an ongoing issue. I think that's going to continue with the doctors. What we try to do is talk to our clients, our patients, to be honest. It's your life and it's knowledge that we're giving them. So, it's going back to the patient, having to be honest with these doctors and saying, no, I don't want to take that. Is there anything non-narcotic I can take? Just going through that scenario with them.
I think we've lost between 5 and 8 from our clinic this past year to overdose.
That's too many.
That were currently in our program, enrolled in our program.
So it is a national epidemic, and we appreciate you guys wanting to get more information. Appreciate you providing us. And if you have any questions, or you have someone that would like to look at our services, our number is on.
Yeah, I put a packet on it.
The Beginning Treatment Center is where we are, and our information is on there. There's the number, the office number is 903-758-0596. So if we can't help you, we'll help them get in the right direction, okay?
Okay.
Thank y'all so much.